Good day everyone, this is Dr. Lina Abad and we'll be having a brief discussion about Quervain's Tenosynovitis. By the end of this video, I'll be showing some rehabilitative exercises that you could do at the comfort of your own home to better improve the symptoms of your condition. First, what is Quervain's Tenosynovitis? It is a condition where the tendons on the side of the wrist at the base of your thumb become inflamed. These are extensor pollicis brevis and abductor pollicis longus. The inflammation of these tendons gets worse with the abduction of the thumb, grasping action of the hand, and ulnar deviation of the wrist. You can also experience thickening and swelling of the affected area. Quervain's tenosynovitis is common among people who perform repetitive wrist motion, such as playing racket sports, doing office works, playing musical instruments, specifically the piano, carpentry, and even heavy machinery driving. It is also associated with lifting heavy objects, and classically, mothers who lift their children with thumbs radially abducted and wrists going from ulnar to radial deviation. Women have a slight prevalence than men, and most of the symptoms occur at their 40s and 50s. Hormonal changes during pregnancy is also a risk factor. How is it diagnosed? Through history and physical examination, the patient's pain is assessed and is usually found at the base of the thumb or the wrist area. The patient may also be asked to perform different motions, such as using a stapler or opening a jar. Another important physical examination is the Finkelstein test. First, you place your thumb against your palm, and then you put your 4 fingers over it, therefore making a fist. And then, in this position, you move your hand towards your little finger, therefore bending it. Again. Once you do this movement, you will feel the pain on the wrist area or the base of your thumb. So I am positive for Finkelstein test because I have felt pain upon doing that motion. How is it treated? Thumb stabilizer or wrist splint may be used to support the affected hand. Non-steroidal anti-inflammatory drugs may also be taken to reduce swelling and relieve pain. In some cases, corticosteroid is injected onto the tendon sheath to reduce inflammation. And most importantly, rehabilitative therapy is done. What can we do to prevent this condition? Before we start with the rehabilitative exercises, we should always do warm-up exercises. And this one is to combine warm-up and therapeutic exercise. So we maintain a good standing position and avoid slouching. Put your hands in front of you with your palms facing your trunk. Then slowly rotate your arms and hands backwards towards the side of your hips. Take note that we do not pull them backwards. What we do is just a rotational movement. We can do this while performing deep breathing exercises as part of the warming up process. I call this the orchestra exercise as it imitates the movement of a conductor of an orchestra. We now proceed with the exercises. First is the extensor abductor without band. The goal of this exercise is to stretch out the muscles against the pushing force. So you do a thumbs up sign with your affected hand, then with your other hand, you push down your thumb while putting resistance to it. You could also use your palm. So you take your thumb back and push down. You hold it for at least 5 seconds, then slowly progress up to 30 to 45 seconds. In that way, you build the power of your muscles. You can do this for 5 sets a day. Next is the extensor abductor with band. The goal of this exercise is to loosen and lengthen the muscles with eccentric movements. Remember to avoid the shortening exercises since the muscles are already tight. So you get a rubber band of this size. You could use the ones found when you get vegetables from the market, a ponytail, or any rubber band that would fit the size of your fist. For today, I'll be using a tourniquet which we could tie up like this. So you put all your fingers inside a band, open them a bit, then slowly pull out your thumb to the side using your other hand while maintaining the position and keeping tension of the other fingers. Once you stretch out that thumb, you slowly bring it inwards by itself. If it causes a bit of discomfort, another way to do this is to just hold it for 45 seconds and slowly release. This can provide pain relief. We can do this for 45 seconds and a minimum of 2 sets of 10 with 1 minute rest intervals. The extensor abductor exercise with band exercise is also good for relieving tension and improving muscle strength. And last is the pronator. In this exercise, we hold a weight with at least 500 grams. It can be a dumbbell or just a half-liter bottle at home. So you push your forearm on the table, and by holding the weight, you rotate your forearm outwards with your palm facing up. Then slowly rotate it inwards with the help of your other hand. We do it again, rotating outwards, then back inwards slowly. We should take note that once pain intensifies in between these exercises, what we can do is rest for 15 to 20 minutes. This is important not to irritate the inflamed tendon. I hope you learned a lot about Quervain's tenosynovitis. Thank you for watching.